So I'm open to any questions about any of this. There's somebody at the back.
Yeah, we were given one quote around the application costing between, ongoing payment between $500 and $900. Is that still sort of the case, or can we have other information around that?
That's a good question. The membership fee is directly related to the size of the membership, actually. And the very large colleges, like the College of Nurses, which I am a member, the registration fee is about $140 a year because they have so many members. Smaller the profession, the higher the fees. I think the midwives' fees are way up there. We don't know what our membership is going to be as yet, and particularly until the registration regulation is finalized and approved by government, and we know exactly who the potential members are going to be in the two categories, registered psychotherapist and registered mental health therapist. It's very difficult to predict. We were certainly hoping that the registration fee would be approximately $400 a year. We would like to be able to keep it at that level if possible. I think a lot actually hinges on the fate of the RMHT, Registered Mental Health Therapist category, and who will be in that category and how large that may be. And we await news from the Ministry of Health in order to start putting some detail around that. Yes?
Can you speak to the title issue and whether PhDs would be able to use doctor, whether we would be able to practice the Controlled Act, and also whether insurance companies are likely to cover us?
Well, those are three questions. I'll try.
Questions.
All members of the college will be able to practice to perform the Controlled Act of Psychotherapy, which, as I don't know if you are all familiar, but the wording of the Controlled Act, it's a subset of the scope of practice, and it really focuses on working with clients who have serious mental health issues, serious disorders that may seriously impair their functioning. If you're working with those kinds of clients, then you would be doing the Controlled Act of Psychotherapy. All members of the college will be authorized to do the Controlled Act. So then the question really becomes whether you have the skills and competency to work with a particular client with a particular kind of problem. And as a regulated health professional under the provincial legislation, you have to understand when you have a responsibility to refer a client to another kind of professional. In some cases, perhaps a psychiatrist, if somebody is, obviously in need, likely of drug treatment, for instance. Now, the next, pardon?
We still wouldn't be able to diagnose.
Yeah, I was surprised at what Dr. Goldblum said. Psychiatrists can diagnose. As far as I know, psychologists can communicate a diagnosis, which is not exactly the same as diagnosing. Remember, diagnosis is a controlled act, and members of our college will not be able to diagnose. No. As to using the title doctor, a PhD, members of our college will not be able to use the title doctor in the clinical setting. In an academic setting, at the university, in the community, yes, you would be able to use your doctor title, but not with clients and not in a clinical setting. Certain professions are authorized to use that title, and one might imagine that going forward that this is something that members of this college will want to look at in the future. But right now, no.
And my third question was about insurance.
Oh, insurance. Well, that's actually not a question for the college. You're talking about coverage, insurance coverage of your services. It's not something we have any control over. It would seem likely that as time goes on, that as regulated professionals, that insurance companies will begin to offer that kind of coverage. Particularly, as Dr. Goldblum alluded, perhaps your services may be more cost-effective than some others, but that's an issue for the profession and for your professional associations, not really an issue for the college. Our mandate, our role is to protect the public, to ensure that members of the college and practitioners are qualified and accountable. Anybody else? Yes.
Can you belong to two colleges at the same time? Can you belong to two colleges?
I'll repeat the question. The question is, could someone belong to two colleges at the same time? The answer is yes. You would have to fulfill the requirements of both colleges, but there's no requirement that somebody who's already a member of one of the other colleges, whose members can practice psychotherapy and use the title psychotherapist, that they would become a member of our college. They don't have to be. They don't have to do that. They don't have to become a member of our college. And there are situations even now where, but I think it's fairly unusual, where somebody who, say, is a registered nurse is also a physiotherapist. But that's quite unusual. Anybody else? Yes.
The microphone now works.
Can you hear me? No?
Yes.
I had a question on kind of input you take with respect to supervision, because for those of us who work in the NGO sector, some of our supervisors retire, they have clinical experience, they're out, and then we get people who don't have 5 years you spoke of. They may have the qualifications, but they lack the amount of experience. That happens in some of the NGO agencies. So then that would put some of us at a disadvantage with respect to accountability for supervision. Is that taken into account?
Okay. Are you talking about supervision that you received in the past?
No, supervision. My understanding is
So I can't hear you.
Mike's off.
That's on now.
How does the supervision work? I understood that you two said that you're looking at those of us who are employed in the NGO sector, right? We are sometimes supervised by people who don't have the same experience, because supervisors who had a great deal of clinical experience have retired. So now we are being supervised by people who have the qualifications but may lack. They call supervisors.
So what kind of supervision are you talking about? Are you talking about your
They're considered supervisors, but actually they lack the clinical experience. Some of the staff have more.
But is this somebody who's your manager as an
That's
employee?
right. Both manager and supervisor. So
And they provide what is normally thought of as supervision
that's correct.
in this profession?
That's
Right.
correct.
What we call clinical supervision, which is 1-to-1 or 2-to-1 or group supervision, where
We have different types. So it's group supervision, peer supervision, triad supervision, and the one-on-one stuff.
Well, when I assume you're going to apply for grandparenting. So we're talking about what, the nature and the amount of supervision you have received in the past prior to application, right?
That's correct.
Right. Well, we're going to ask you to tell us about it. The requirements that I just mentioned in terms of somebody who's an experienced practitioner with 5 years, really we're talking about people, new graduates, people that are applying through the main route to registration.
So it would be a non-issue then for those of us who are.
You know, I can't say that it's an issue or a non-issue. I think we're going to be looking at the whole picture of your education, training, your clinical experience, including the type and the amount of supervision, including clinical supervision. So it's going to be the overall picture that is going to determine whether or not you're eligible for registration. The fact that one of your supervisors didn't have a certain number of years of experience is really what you're saying, right? Or your current supervisor.
That's correct.
Yeah. Well, that factor alone should not be a deciding factor, I would not think it could be. But you're getting into a level of detail in terms of how the assessment of this portfolio evidence is going to be assessed and weighted and so on. And we haven't determined all of that as yet, so I don't have the real answers for you.